I'm Karen Culverhouse, and my patient today is a 45-year-old female with a diagnosis of left carpal tunnel syndrome. Her past medical history is unremarkable. She's on anti-inflammatories currently, and she works as a medical transcriptionist, so she's doing a lot of repetitive motion with her wrists, a lot of typing, and that is most likely what has caused this issue. Carpal tunnel syndrome is characterized by sensory loss and motor weakness that happens when the median nerve is compressed within the carpal tunnel of the wrist. That's a confined space between the carpal bones dorsally and the transverse carpal ligament volarly. The median nerve is susceptible to pressure there as it courses through the tunnel with the extrinsic finger flexor tendons on the way to the hand. And anything that decreases the space in the carpal tunnel could compress the mobility of the median nerve. And in this patient's case, it's most likely a result of a repetitive or sustained wrist flexion, extension, or gripping activities. It's an overuse trauma in this case, where she's also has some postural issues in the way she's sitting at her workstation and holding her wrist and in the repetitive motion. So she's having increased pain at night, waking up 2 to 3 times a night with pain, numbness, and tingling, and also increased pain after 15 minutes of typing. This has been going on a few months. She's in physical therapy now to try some things before having carpal tunnel release surgery. So we're hoping we can find some good tools here that'll work for her and to avoid surgery. Stop. Hi, Ms. Rogers. I'm Karen Culverhouse, I'm a student physical therapist assistant with Jeff State, and I'm going to be working with you today on your wrist. Is that okay with you?
Yes.
Okay, great. And before we get started, I just wanted to ask you about your pain level today on a scale of 0 to 10, 0 being no pain and 10 the worst pain imaginable.
Yeah.
What would you rate your pain right now?
Somewhere between 2 and 3.
Between 2 and 3? Okay. Is that different at any other time of the day?
It's worse after I've been typing for a while.
Okay.
Or at night sometimes.
At night? Okay. All right, we're going to see if we can help with that.
Okay.
The first thing I want to do, I know it's your left wrist that's been causing you problems. We're going to just relax that here. And what I'm going to be doing is a little bit of a joint mobilization. I'm actually going to stand to do that. And what that means, I'm just going to be holding your arm here and just pulling gently just to relieve some of the pain in there and try to open up that space a little bit just to get some movement. Do you have any questions about that?
No.
Okay. Well, just relax. I'm going to hold here. I'm just going to gently pull out. Is that okay? I'm just going to hold that for a minute. I'm just going to do that about 5 times. And with that nerve being compressed in there, this sort of joint distraction, it just gives it some more room. And we're going to do this, and then I'm going to show you some exercises and also some ways to sit at your workstation.
Okay.
Okay? Is that still feeling okay? I'm just going to do this the first time. Next time you come in, I'm going to add some additional mobilizations to increase flexion and extension. We're just going to start with this one today.
Okay.
I'm going to do one more. And relax. Okay? Now, what I'd like you to do is show me how you type when you're sitting at your workstation and doing your medical transcription.
Okay.
You're just pretending this is your keyboard
Okay.
and computer.
Usually like this.
Okay. All right, so what we want to do is we want to keep your wrist neutral, and I'm just going to show you a way to do that at your workstation.
Okay.
What I want you to do first is let's stand up and increase the height of this chair a little bit. Okay. All right, when you're at your workstation, okay, good. You see, and you want to be able to keep your wrist neutral. Also, if you can, they make pads that can go in front of your keyboard so you can rest your wrist on there.
Okay.
Okay, and that's just going to be more comfortable to you, keeping that neutral, and then that's going to take away some of the pressure on that nerve too,
Okay.
which should help.
Okay.
Do you have any questions about that?
No, that feels good.
Okay, great. All right. And the other thing I want to show you is a home exercise that I want you to do, and it's just going to increase the mobility of that nerve. And I'm going to also give you a handout on this to take home.
Okay.
But what you're going to do first is you're going to Bring your arm out just with your fist. Neutral position, just
Mhm.
relax like this. This is step one. The next step is this. Now, I want you to tell me, we're going to proceed through a series of steps, and I want you to tell me if you feel any numbness or tingling or any symptoms. Okay?
Okay.
All right, so you're fine here?
Yes.
All right. The next thing I want you to do is extend your wrist. Bring your wrist back like that.
Mhm.
Is that okay?
Mhm.
All right. Now I want you to bring your thumb out.
That's a little different.
Okay, are you feeling some tingling there?
Mhm.
Okay, then we're not going to progress on to the next steps. What
Okay.
I want you to do, as long as this doesn't become increasingly painful or exacerbate your symptoms, I want you to just stop with this one.
Okay.
I want you to hold that for 15 seconds,
Mhm.
and then I want you to go back to the position right before it. And hold
Okay.
that 15 seconds.
Okay.
Okay, I'm sorry, this one. Hold that 15 seconds.
Okay.
Okay, then go back to this one that was causing the symptoms.
Mhm.
Hold that for 15 seconds. I want you to do it 5 holds each way and 3 times a day. And I'm going to put that on your sheet.
Okay.
And on the sheet, you're going to see if you get to the point where you can go to this step and you're not having the symptoms anymore,
Mhm.
then the next one is to bring your arm out like this.
Mhm.
And the one after that is to use your hand underneath and pull on that thumb. Okay,
Okay.
that's the 6th one, and I know that may be bothering
Okay.
you right now. If the
Mhm.
other one was, so you stop at the one where you feel the symptoms, hold 15 seconds. Go
Okay.
back to the one before, 15 seconds.
Okay.
And like I said, I'm going to give you a sheet with all of that.
Okay.
Do you have any questions about that?
No.
The main thing on that is if you don't want to exacerbate the symptoms. So if you start to have increased pain, just stop and go down a notch.
Okay.
But what that's going to do is it's going to give some more motion to that nerve.
Okay.
Okay?
Good.
Okay, Ms. Rogers, well, that's everything we're going to do for
Okay.
today.
Mhm.
I did see in your chart that you're going to be getting a wrist splint. So
Right.
they
Mhm.
want you to keep that on as often as you can. You can have it at night. And that's
Okay.
just going to help to keep that wrist in a nice neutral position.
Okay.
And so next time when you come in, we're going to be doing some more exercises.
Okay.
I'm going to give you the sheet for your home exercise program to
Mhm.
take with you. So be sure and do that.
I will.
We're going to see next time if you have decreased pain at night. And also we're going to be testing the strength of your thumb for
Okay.
this motion and see if we can increase strength on that.
Okay.
And remember at your workstation, shoulders back, nice straight back, neutral wrists, looking straight ahead. So we're going to work on that posture as well.
Okay.
Okay? Do you have any questions about anything we did today?
No. Thank you.
Okay, great. Have a good day.
Thank you.
All right, bye-bye.
Bye.
As far as the prognosis for this patient, is really going to be patient dependent. This treatment plan was just for a couple of weeks in order to see if this treatment would be effective, and if not, if she was still having symptoms or no relief in symptoms, then looking at a carpal tunnel release surgery. So as far as the prognosis, in 2 weeks you may need the surgery, but if these methods are effective, then in some cases it's possible to avoid the surgery and relieve the symptoms first of all, and then build on muscle strengthening and postural changes and different things like that. And she will also have the wrist splint to help with that. If you have any questions, please let me know, and thank you for watching.